this is week 4 of the slideshow presentation, the PowerPoints that go with our lecture for the Masters in Healthcare Administration 575, which is Quality Healthcare. We're going to talk about survey tools for healthcare quality, one being the NDNQI, which stands for National Database of Nursing Quality Indicators. It is the only national nursing database, and it provides quarterly and annual reporting information regarding structure, processes, outcomes to various indicators, and it's to evaluate the nursing care at the specific unit level. I have included the website in case you want more information about that. Their goals include providing participants, so that being the hospitals, with comparative data, which is at a national level, and also they want it to be geared towards quality improvement. They also are looking at that relationship, so that bonding of the staffing and the level of nurse staffing and the patient outcomes and that correlation. Also, they are looking at 50 states, so it's a broad span, it's a huge database. It is a voluntary process for members to report. There is a cost to be involved to help cover for some of the behind the scenes data collection and drill downs that take place, but again, it's voluntary if you choose to be a member. It does address the various types of hospitals and sizes, and whether it's academic, teaching, non-teaching, what kind of specialty it is, if it's a for-profit, not-for-profit. So a lot of different information. You can slice and dice information many ways. They started in 2005 reporting patient outcomes with that nurse staffing data, and so presently some of the primary units, they've expanded a little bit beyond this, but it still remains critical care, your step-down unit, your med-surg, psych, pediatric, rehab. Then going on to looking at other survey tools, ARC, which is the Agency for Healthcare Research and Quality. In November 2004, they released a Culture of Patient Safety survey. So they're really wanting to get to the root of the staff and what is their perception for safety. There's no charge for individuals to participate in this survey. It is tested for reliability, so again, you feel like it's got that sound scientific basis from a statistical component. You can compare yourself with other U.S. hospitals, and actually they had documented that as of December of last year, it has grown to include many international users, up to 64 countries and 30 different translations. So it really continues to expand as everyone wants to improve safety. It is designed to help the hospitals assess the culture of the safety, and it's based on that that staff feedback and that staff perception. They do have specific surveys not only for the hospitals but nursing homes, community pharmacy, ambulatory surgery center, and a medical office environment as well. And I did include that website also. The survey tools, they are looking also at employee satisfaction, perception survey. We tend to call them employee engagement surveys. This truly started back in the late 1800s, and it was Frederick Taylor who was the pioneer for this. He was an industrial engineer, and he liked to study people's attitude and how that impacted their productivity in the steel industry. So really not much different than some of the different trends that we see today. It is usually conducted annually, doesn't have to be, but I tend to see it usually annual, that they have the surveys. It's a pulse check. The negative thing about that is if you only do it once a year and then you're not reaching out and interacting with staff and finding out what's going on, you might miss some other issues that are really driving employee commitment or dissatisfaction. The one thing that the surveys do help to point you to where do we have opportunities? And from a retention standpoint, that's really significant because you want to retain good quality staff. You'll see a lot of times people, even when they have staff that leave a position, they'll do an exit survey also. And again, just trying to find out where could we improve? What opportunities do we have? So I mentioned about employee rounding. If you want to do something a little bit more often, it's more real time. So you got rapid cycle response that you can get feedback and then react to what that employee is telling you. So this one site in Forbes, they were talking about it being a continuous holistic approach as part of the business strategy. So I think that was really just a good thought process that, the business side of it, and you've got to have your employees and you've got to have satisfied consumers, which we have to keep in mind our patients, but also our staff as well. Patient surveys. You'll see the HCAHPS information quite a bit in healthcare. It actually stands for Hospital Consumer Assessment of Healthcare Providers and Systems. CMS and Agency for Healthcare Research and Quality, along with Health and Human Services, started this in 2002 for the development of the survey. It has been endorsed by the National Quality Forum, which is basically the gold standard. And in October 2006, they did start publicly reporting this information. It is on Hospital Compare for anyone to review what a hospital's ratings are. And you can go in and you can look at local hospitals, same with your harm events and mortality and readmissions. You can look at these survey results and see how does a hospital locally look compared to other hospitals, and it can be compared even with other hospitals across the nation. They've added some questions in 2013, and those included transition to post-hospital care, admission through the ED, and mental and emotional health. So they do keep improving, expanding to get more valid information that we can use to help our patients. It is national, it is standardized, they do have the valid comparison. I mentioned it is publicly reported, and there's also incentives tied in for hospitals. So, as a hospital, we're wanting to improve quality of care, so that's making us more accountable to be very aware of what our customers are telling us. And again, that level of transparency, I think anytime you measure anything, people know that you're measuring it, and what follows is usually there's improvement. So it is looking from the patient's eyes, so their perception of their hospital experience, and I guess CMS is really also gearing at making it a user site. When you go to Hospital Compare, they've added a star rating. So you can even at a quick glance see how a hospital rates as far as having 1 star, 2 star, however many, to see quickly, how do they stand in healthcare quality. I think the other thing is important to know with these surveys, it's really what we would want as a patient. If we were in that hospital bed, we want to know about our our medications. We want to know, our doctors communicating to us well, our staff, the nurses communicating to us, the hospital's clean, the food is good, our pain is managed. So all these key components that we want that patient to experience, this is what the survey is asking. And so I think, again, if you put the incentive aside, put quality first, all will come in good time and keep moving us in the right direction. So what do? We have all these surveys, and I think critically you have to follow up. You need to review the data. You might need to sit down and have a brainstorming session and come up with action plans. You might even need some clarification. We've had to do that before. We had some questions that we thought we did a little bit better on a quality stance, and the staff were saying that we didn't do as well. And so we really had to clarify with what was their definition of quality compared to what our definition was. So again, making sure everyone's on the same platform so that you're making appropriate improvements. We need to be sure and share the results. If we take the survey and then we just sit on it, we don't do any actions, we don't share it with the staff. That's not the purpose of this. The purpose really is for it to be dynamic, for us to go back and revisit it. What I like to do is when we have staff meetings or when I have one-on-one meetings with staff I work with, or even an employee rounding, is to bring up feedback they've given me or feedback from surveys, and then let them know this is what we've done based on that information. We have a stoplight report, and why it's called a stoplight is it's geared from a color coding, red, yellow, green. So if I have an employee give me an idea and I'm going to follow through on it, and it's something that I've got in motion but I don't have it completed yet, I would put that in yellow status on my spreadsheet. So I just am going to yellow highlight the cell that I have that on in that Excel spreadsheet. If it's something it's beyond my control, I cannot do anything about it, that would be in a red category. And by the same token, if it's something that I've already acted upon, we've got it implemented, and it's a done deal, I'm going to color code that green. And then I share this stoplight report to all my staff so they see this is what some of their coworkers came up with, and these are the action steps that we took, and this what is in motion, or what is active at this point, versus what we can't move the bar on. It also keeps it fresh in your staff's mind, and it keeps everyone really encouraged to keep making changes and corrections and to give us feedback. If you do get actions and you get information, follow through on your actions. I can't say how frustrating it is when you have a concern and then there's not that follow through, there's not that closing the loop, closing the gap, and making sure you have that communication come full throttle. So safety drills. Miracle on the Hudson. I've heard many people say, yeah, this is amazing that, all those passengers survived, and they had to land in the Hudson near New York. But what happened, was it really a miracle, or was it just really good drills and training? I know Captain Sully, he would argue that it really wasn't a miracle. It was just he went into automatic mode. They had completed many, many drills. They just automatically know what to do and how to respond, knowing that they have those passengers' lives, on them. So again, you can kind of look at it both ways. Was it a miracle? Maybe. Maybe it was just really good practice and good safety drills. Hospitals, they do safety drills, and I think most facilities do, but for fire, tornado, disaster, we also have infant abduction. We're trying to always make sure that if any of these situations come up, we are going to know what to do. It's going to be automatic. We know if we have an infant abduction, everyone's going to man the doors. We're going to guard those exits so no one is going to leave. And again, it's just going to be an automatic process that we know what to do. These help us to not only develop, test, find any kind of gaps, kind of see anywhere where we need to make improvements, and again, have that continuous evaluation. There's also the tabletop drills, so you can kind of do a simulation just even in a room and talk through a scenario, and then talk about what you would do. There's also the internal drills. Sometimes you'll loop in the community to do the drills. A lot of times you'll see this. We've done some with maybe a semi-truck disaster on I-70, or we'll have something that's happened with a situation where there's been multiple fires, or a plant that had an explosion, and so we're having people act as actors in this catastrophe and disaster, and then we're trying to manipulate the triage and get them to the correct location, get the correct treatment, and still be able to maintain our current staff load in the hospital. So you always walk away from that with learning new information and where you need to make improvements. I did add on here from Orlando Health, this coming just behind the Orlando shooting situation just recently. I felt really proud of the staff. They were all commending each other, they were patting each other on the back. That was a very traumatic experience for all of them. It was for obviously the victims, their families, the community, but being a healthcare individual, I immediately thought about the staff at that hospital and what they had to do, and that many victims coming into their facility at Rapid Cycle, and we're talking about gunshot wounds and severe injuries. So I feel like that a lot of their drills and their practice helped them to succeed, helped them to manage the rapid volume that they experience, and then to save lives. So good work, and a really good example of what safety drills can do and how it can save lives as well. So with the safety drills, we need to consider, how often do we need to do those? There's some recommendations. They actually have talked about if you have a change in your plan, any kind of emergency response change that you need to get out, change in staffing. If you have a lot of new staffing or you have different staff in specific roles, you might want to consider one at that point. Also, if there's a change in property, infrastructure changes, you might need to evaluate to see, do you have everything in place? Do you need to make adaptations to your emergency plan? So, from a safety drill standpoint, you want to make sure you're solid. If you have any kind of unforeseen problems, any kind of major upcoming events, I know when the prison was having the McVeigh um, execution, there was a lot of drills that went on related to that in Terre Haute because they were really anticipating a large volume of individuals coming, news media and so forth, maybe protesters. They wanted to be prepared, so they did a lot of planning ahead of time from a safety perspective. Also, if there's any new developments that come up, any threats that need to be prepared for, Ebola was a classic that recently many of the healthcare facilities we did a lot of training, practicing, and just reviewing what our process would be should that go broader and we'd be looped into that kind of a situation. So last slide, safety drills. The FEMA also is the Federal Emergency Management Association, Homeland Security. They're also looking, do you have adequate supplies? If you lose power, do you have supplies to get you through X amount of days? And so these are all things that within your organization you have to be looking at what your state, your federal, your accrediting body, what they require so that you can be prepared. They also have requirements where they're looking at your drill records and how the frequency, and are you matching the number of drills that you do based on what your policy and procedures are. So that is something that when we've had surveyors here, they are asking for that information. So I think that's good just to be aware of as well. I don't know that I always thought about even for gas, having gas if we'd need it, have extra supplies, and how would we get food into the hospital. If the air conditioning went down, and refrigeration, you just have to kind of think about all these worst case scenarios and then see, what would we do, who do we partner with, and how could we get through that crisis. So those are just some other thoughts for you to keep in mind, and I hope you guys have a good day. Thanks.